pertaining to that, like innovations which you adopted, and the technologies which the common people they don't know, and even the so-called the people who are working, they also don't know what are the innovation technologies which really helping.
The most important thing is home-based childcare program. In our home-based childcare program, we have trained the local tribal female, semi-literate to illiterate female, for identifying the illnesses in the community and the treatment. They have been trained for treating illnesses like diarrhea, malaria, pneumonia, newborn disease like neonatal sepsis, birth asphyxia, low birth weight baby, premature baby, etc. They have served many critical babies suffering from neonatal sepsis, birth asphyxia, and from diarrhea, malaria, pneumonia. They have been also trained to treat severely malnourished children in the field itself. So I think this, as I have told, there are no doctors and specialists in most of the hospitals in Melghat, and people are reluctant to go to hospital for availing the facilities. This home-based childcare is the best way to take care of this issue of child death and malnutrition in this area. Second thing is, which we adopted, is home-based treatment for severely acute malnourished children itself. That is called Samman program, where these children have been severely acute malnourished children. They are being fed WHO prescribed ready to use therapeutic food prepared by our organization with the help of local tribal female from the locally available food material. So it is low cost sustainable solution for treatment of severely malnourished children. The third approach we adopted is counselor program. As you know, there are around 13 to 14 hospitals in government hospitals in Melghat, but the conditions of the government hospital was very bad. The doctors used to close the hospital after 12. There were no ambulances available, no proper food and medicines were given. So our male and female counselors, they used to admit the patients, especially pregnant ladies and children in the government hospitals. They try to take care of them. They were acting as a bridge communication between the government doctors and the poor tribals, as they were from the same community, and they also tried to strengthen the existing government health system. Like if somebody is not getting ambulance, they will arrange the ambulance. If the doctor is closing the hospital after 12, they will ask the doctor to stay in the hospital for 24 hours. So there was significant improvement in government hospitals after this counselor program. I think this is one of the innovation which nobody tried in India. Then third innovation is of nutrition garden. We have developed around 2000 nutrition garden in 16 villages of Melghat, which produced enough quantity of fruits, vegetables, pulses, etc. And it will be a sustainable model and long-term solution for treatment of and prevention of malnutrition. Then next approach I suggest is intensive behavior change communication program for improving the health and hygiene of the people, for the nutritious status of the people. I like to quote one example. We have not given any form of supplementary nutrition or treatment to the pregnant ladies, but our village health workers are regularly giving health education at least 3 to 4 times for each pregnant ladies during their pregnancy. They are advocating hygiene, proper nutrition, then advocating proper immunization to these ladies, and due to this the maternal mortality rate has been dropped by 50%, and the prevalence of low birth weight baby has been reduced by more than 50%. So intensive behavior change communication will have great impact in reducing malnutrition and child death as well as maternal mortality in any tribal area, I think, of India. So this is the major innovation we did. Then second thing, I think there are some issues which has to be solved at the level of government. Like government must compulsory post at least one MBBS doctors in all government hospitals. These doctors should not get their some certificate for practice unless and until they finish 1 year posting. They should be given extra incentives like more salary to doctors who are working in tribal areas. There should be some reservation for postgraduate seats in medical colleges for those MBBS students who have finished 3 years service in such tribal or rural areas. Then there should be permanent posting for such doctors working in tribal areas. If government will provide such incentives and such compulsions, then I am very confident that all primary health centers in rural hospitals of tribal areas will get good quality of MBBS doctors. Similar is the condition of specialists like gynecologists, pediatricians, anesthetists, etc. So there will be compulsion for such specialists in these areas, compulsory posting. Then definitely there will be much more specialists will prefer to stay in such area. Like government can ask bond of around 50 lakh rupees for from each candidate. Then all sort of specialists will be present in all government hospitals. So this can be one of the solution for tackling the issue of lack of or scarcity of specialists and doctors in such areas. Then fourth is starting the nutrition rehabilitation unit. The if government will start nutrition rehabilitation unit in each of these government hospitals with a nutritionist at least one each taluka, then definitely there will be improvement in the nutritional status of the children of this area. So government will do this small thing. I think there will be a lot of reduction in child deaths and malnutrition. Another innovation what we tried is involving the medical colleges of India. If each medical college will adopt one tribal hospital from tribal area, then they can depute on rotation basis all experts like gynecologists, pediatrician and anesthetists in such area. So doctor will also prefer to come at their house. They will have to stay just for 1 or 2 months here, and the area will get experts, and the doctors also will get exposure of the real status of India, especially child death, maternal health issues. So, and we tried it since 15 years. We have tried our hospital with Mahatma Gandhi Institute of Medical Sciences, Sevagram, and Kasturba Society. So, this area, more than 1 lakh patients have been treated in our hospital. Similar model can be replicated all across India. So, these are the few solutions I think will be able to tackle similar problems.
The success stories in the malnutrition, that is A, and B, the failures. In failures, like we would like to know the failures in aspect of the social belief. So with that social belief, so we can through advertising agencies, NGOs, corporates, or we can launch any campaign to overcome that social belief. So first success story and then failure.
Success story is that we during last 5 years, that is from 2005 to 2010, due to our this home-based childcare program, we could reduce the infant mortality rate from 96 to 40. So more than 54% reduction in infant mortality rate. The under 5 children mortality rate has been dropped down from 140 per 1000 live births to around 72 per 1000 live births. That is again 50% reduction. The prevalence of severe malnutrition has been dropped down from 9.6% to 3.2%. These are the major success of our program. Then the prevalence of low birth weight baby was dropped down from 60% to around 25%. Then the maternal mortality rate has been dropped down by around 50%. Then the mortality in the age group of 16 to 60 years has been dropped down from more than 400 per lakh population to less than 200 per lakh population. So these are the major successes. The second achievement is, I like to quote few examples also. Like there was one baby of suffering for birth asphyxia in village Mansudhaudi. Our 7th standard pass village health worker Sukri, she treated that baby for 60 minutes. Nobody will believe it. For 60 minutes with the help of ambu bag and infant mucus sucker, and she saved that baby. In medical college also, we advise to resuscitate a baby of birth asphyxia for just 30 minutes. But she desperately tried for 60 minutes and saved that baby. Second success story, one of our village health worker, Mirabai, she's again 6th or 7th standard pass from Tarubanda. There was one case named Lakshmi. Lakshmi was severely underweight. Maybe her weight was around just 5 kg at the age of 2.5 years. Just imagine. She was on the verge of death. That baby was admitted in government hospital Amravati for 15 days. There was no improvement. The parents brought the children to home, and Mirabai, under the guidance of our doctors and staff, Dr. Dani and Kedakar and like our team, treated Lakshmi, and you won't believe, Lakshmi's weight is more than 9 kg at present. She is absolutely normal. So this is a very big success story. Third, Sumantra from Pohora. There was one case of neonatal sepsis. That baby was refused hospitalization in government hospital, Dharni sub-district hospital. The parents were advised to take that baby to Amravati for further management. The parents refused. They went to village. Then again, Sumantra, under our guidance, treated that baby with the help of injection gentamicin and saved that baby in the village itself. So there are many cases which were saved. Shamim Mausi from Hirabambi, she saved a baby of 800 gram by proper care in the village itself. So I'm very proud of this all village health worker. They also saved many pregnant ladies. Like there was one case of eclampsia, preeclampsia in village Ambadi. Our village health worker and our medical supervisors, they detected the case, then referred to Amravati hospital at proper time, and then cesarean section was done, because at that time we were not having cesarean section facilities and that mother was done. So
And what about the failures
Failures,
pertaining
there
to
are-
the social belief?
I don't think there are much more failure for social beliefs, but there were definitely few failures. I won't say it's failure, but it's a very big challenge. We could not mobilize the political system here. As we raised, raised the issue of malnutrition, child deaths through media. The grassroots government system was exposed, and they become very depressed. Then they tried to keep me mum from all sorts, by threatening, by putting fake cases against me, trying to arrest me twice, like this, demoralizing our staff. Then they found that nothing is working, so later on they instigated the political system here against our organization and myself. The whole political system did lot of things to again arrest me, to do all possible. They try to involve the ministers to reduce our power. They tried to misguide the community, misguide the staff. It created a lot of problems for our organization. I think this is the biggest challenge for our organization. I'll request your organization to highlight this issue through your all possible sources, so that there will be pressure over this so-called key people of the society who are I'll say they are prastapits. They don't want that the poor tribal should develop. They want this all poor tribals should remain as their slaves for a long time, and any person like us who are trying to awaken this community, they will always try to oppose such people and organization. So we should highlight this issue. The another challenge was due to our counselor program. When we started the counselor program, there was improvement in the government hospital. What was happening? Initially, the government ambulances were being misutilized by the political people, government officers for their personal gain. Shall I stop? Then second thing, the food which was supposed to be given to a malnourished child and his or her parent, for that government was investing 104 rupees for each day. That proper food was not given to most of these children in these hospitals. Medicine were not given, and we expose all these things through our counselor program. So now they have to give ambulance, the doctor have to stay in the hospital for a particular time, and then they have to provide proper medicine and food. So the whole political system and government system was disturbed due to that. So one corrupt district health officer came. He stopped the program after 3 years. We tried to convince all government system up to secretary level to restart such a good program. They did not listen. So we put a public interest litigation in Mumbai High Court with the help of our friends Bandya and Purnima. And Honorable Chief Justice of Mumbai High Court asked government to restart this program. So this was, I think, a big success. After a big challenge, it was excellent, and it hampered vested interest of many of the people, and they created many problems for us. I think this was the biggest challenge we should